Namaste, Dr. KMK Reddy. Today we'll have a new chapter for discussion. I purposefully use the term chapter because one of the common entities, the common term that is being used by many hospitals is a master health checkup. The moment we hear the term master health checkups, we'll have several doubts, including the usefulness of this procedure and the effectiveness of this and what is its safety and so on and so forth. I am purposefully raising these doubts because this is one of the commonest doubts that is being asked by many people. Doctor, is this master health checkup, is it really a useful procedure or the useful modality from the patient's perspective? Let us understand an important aspect why this concept of master health checkups came at all into existence. Is it a new terminology? No. I'll tell you why. See, the term may be a little bit new. It has a lot of meaning and it has a lot of utility and usefulness, the effectiveness in it. Because there are many diseases, more so in the non-communicable diseases like diabetes, hypertension, for that matter cancer-related diseases, heart diseases sometimes. There are many diseases, I can say, the kidney diseases. There are many diseases that can be completely hidden in the sense they are there with us but not producing any symptoms, not producing any difficulty. So there are n number of diseases, they remain silent in the body and they get exhibited only at the late stage of the problem. So now you tell me, is there a reason, is there a valid point to understand the concept of periodical medical checkups or a master health checkups or a routine health checkup now and then with a good meaningful intervals? That is the reason I have been observing some people who have a very strict discipline. On every fixed day of the year they go for a checkup. Like let us say some people go for a checkup on their birthdays or first day of some month like July or June, whatever they choose. So they fix up the date and they will go for that medical checkup. It is really a good habit. I appreciate them. Really. The reason is, probably I understand, they know the importance of the checkup. I'll tell you a typical example. Some of my patients ask, I am 75-year-old. So far, I haven't gone to any doctor. First time I am seeing you. I am so healthy, no issues. If that claim is there in front of me, I always think they haven't done a good job so far. But they have done a good job because at least at the age of 70, they came to me. The meaning is, based on the risk profile, the propensity of the disease, a potentiality of the problem, they should undergo a medical checkup. They should get a certificate from a doctor that they are healthy. How do they get certificate? Suppose if the basic minimum tests are done, it's not the 100% disease can be covered, at least a common diseases, majority of the non-communicable diseases, if they are covered and they are screened, then reasonably they can be certified or they can be well assured they are the candidates having very good safety from the disease. It's a good certificate. I can say. So I suggest also the people, go for a checkup, take a good certificate that you are healthy, then yes, a good habit also. Rather than claiming that I am healthy without getting a medical checkup even a single time in their life. You may ask me, is it so common that the people remain till 60, 70 without a medical checkup? Yes, yes. Even these days, we have been seeing quite a good number of people coming first time at the late stage of their age for the routine checkups. But this concept, this feeling, this opinion has to be changed. I can understand there is some financial component in that, I know, but still life has a lot of price. So, ladies and gentlemen, why I support the concept of the Master Health Checkup series, when there are many diseases without symptoms in the body, when there is a chance of that, what else is the method? How else we can detect except undergoing a periodical medical checkups or a routine health checkups? Let us say, I'll give you an example. Somebody has a family history, in the sense one of his or her parents died of some heart attack at the age of 40, 45. Okay. This type of people who have family history like this will have some propensity, some risk when compared to other people of having a coronary artery disease at the early age. How to understand this, how to know this, how to detect this problem. The only way to detect is the next generation whose parents have a disease. These people should undergo a periodical medical checkup starting from at least 35 to 40 years of their age. Then only they can pick up early disease. Probably they can also have a better ways of management so that their life can be saved. This is the real meaning of a routine health checkup or a periodical medical checkup or a master health checkup. So the diseases which are there in the body without showing the symptoms can be picked up early for a better management, for a better treatment. So this is something called early detection and treatment. How to detect early? Until unless somebody does a test. Suppose if somebody is having a high cholesterol, somebody is having a high blood pressure or a high sugars or tumor or some other problem in the lung, how to detect all these things? All these things can be detected only by doing tests. Just holding the pulse or just listening to the story, detecting every disease, not possible all the time. Hence, I am suggesting this is a good concept, needs to be encouraged, because we don't know what disease is likely to hit tomorrow. So all these questions, at least to 90 to 95% of the times, can be answered by undergoing a periodical medical checkup or a master health checkup thoroughly with a good credibility from the hospital side. Why I am telling these terms also, see, just like that doing some ECG, randomly doing some sugar test, it is not called a master checkup. There should be a scientific basis, there should be a thorough interest in doing these tests and analyzing these tests and counseling the patients. These things are very important, because ECG will not tell anything. At times you may miss. So a good history, a good investigations and good interpretation of all these results, quality tests, and more than all these things, it should be understood or analyzed by a doctor who has a good clinical acumen, so that the results, the outcome of all these tests will be more patient friendly and more cost effective. So dear friends, I suggest, consider all these things. Please never think that master health checkup concept is wrong. No, never. It has a good concept. Only thing is, it should be interpreted with a good, thorough science and the knowledge. That is very much required. That is in your hands. You have to choose. Therefore, I once again suggest all of you stay healthy by undergoing a periodical medical checkups. అందరికీ తెలిసిన ఒక ముఖ్యమైన పదం ఏమిటంటే మాస్టర్ హెల్త్ చెకప్స్. ఈ పదం వినంగానే కొంతమందికైనా కనీసం ఇబ్బందికరంగా ఉంటుంది. మాస్టర్ హెల్త్ చెకప్స్ వల్ల మంచి జరగదు, ఇదంతా ఎవరి కోసమో దేనికోసమో వ్యాపార నిమిత్తమో ఇంకొకటో దానివల్ల వచ్చాయి అని అనుకుంటారు. ఇది నిజమా? వాస్తవానికి మాస్టర్ హెల్త్ చెకప్స్, రొటీన్ హెల్త్ చెకప్స్, పీరియాడికల్ చెకప్స్ చాలా అవసరం. ఎందుకునంటే ఒక వ్యక్తి ఏ పరీక్షలు చేయించుకోకుండా కాంప్లికేషన్స్తో ల్యాండ్ అయ్యే ప్రమాదం నుంచి తప్పించుకోవచ్చు. అదే కాకుండా చాలా జబ్బులు, ముఖ్యంగా షుగర్ అనేవి, బీపీ అనేవి, కొలెస్ట్రాల్ అనేవి, కొన్ని రకాలైన ట్యూమర్స్, ఇవన్నీ కూడా మనకు ఊరికే ఉంటే లేదా పరీక్ష చేయించుకోకుండా ఉంటే ఇవి ఎప్పటికీ డిటెక్ట్ అవ్వవు. లేదా పూర్తిగా ముదిరిన స్థాయిలో, లేట్ స్టేజ్లో మాత్రమే డిటెక్ట్ అయ్యే ప్రమాదం ఉంది. అప్పుడు వైద్యం చేయడానికి కూడా కొన్ని ఇబ్బందులు రావచ్చు. కాబట్టి ఒక జబ్బుని, సిమ్టమ్స్ లేని జబ్బులు చాలా ఉన్నాయి. కాబట్టి ఈ సిమ్టమ్స్ లేని జబ్బుల్ని కనుక్కోవాలి అని అంటే ఒకే ఒక ఆయుధం పీరియాడిక్గా మెడికల్ చెకప్స్ చేసుకోవడం మాత్రమే వీలు పడుతుంది. కాబట్టి దయచేసి మాస్టర్ హెల్త్ చెకప్స్ని సరైన ఉద్దేశంతో తయారు చేయబడినాయి కాబట్టి సరిగా వాడుకొని అందరూ ఆరోగ్యంగా ఉండాలని కోరుకుంటూ డాక్టర్ KMK రెడ్డి.